Hi everyone, so my name's Tucker. For the past 7 years, I've been specializing in treating neurological impairments and most commonly movement disorders. So that's what we're going to talk about within the next clip. So basically, I'm going to give you a brief insight on what Parkinson's disease is specifically, its most common effects of the individual, and the stages that someone may encounter. So the number one takeaway from this is I want you to remember that dopamine is the number one neuromodulator that affects those with Parkinson's disease. So if you look above me right here, you're going to see this picture of a brain. Within the brain, there's a structure called the basal ganglia, okay? Within the basal ganglia, there's an area deemed the substantia nigra, okay? Within the substantia nigra is which houses the dopamine cells. So the dopamine within the substantia nigra is critical for coordinated movement patterns. So now, if you're able to look over at this diagram, you can see that those suffering from Parkinson's disease have a lack of the production of the dopamine cell, which means that our movement patterns are, of course, going to be impacted. About Parkinson's disease, we're trying to identify any movement patterns that may be abnormal than what we typically see, right? So this acronym above, which is TRAP, stands for tremor, rigidity, akinesia, which is a lack of movement. We also may see bradykinesia, which is a slowness of movement. And then the P is going to be for posture and balance. These are just typical effects that you're going to see with those suffering from Parkinson's. The picture above gives a good depiction of what you would typically see from a Parkinson's patient in terms of posture and movement patterns. You can see the rigidity, you can see the hunched over kyphosis or hunching of the back, the short strides, the shuffling of the steps. It is important to remember, however, that no Parkinson's patients are alike, okay? So one is completely different than the other. They may have similarities in symptoms, but you must treat them according to their individualized symptoms. Okay, and lastly, for this brief introduction, I can dive way deeper into this for you guys, but I think this is a good general basis of understanding. We're gonna go over the stages of Parkinson's, okay? So there are 5 general stages, okay? So you're gonna have patients or individuals that may ask you, what stage do you think that they are in, okay? So typically when we refer to stage 1, we're referring to it as unilateral effects, so only affecting one side, okay? 2, we begin seeing bilateral effects. So of course the symptoms be gradually getting worse. We're talking about a progressive neurological disease here, right? So now you're gonna see a lot more on both sides of the body. It's affecting the arms and the legs. Stage 3, okay? This is when you're gonna get to the balance impairments are gonna start to begin. You're gonna start to notice a real slowness in the movement, so that bradykinesia is gonna set forward. You're gonna have a lot of postural instability. They're probably gonna need the use of an assistive device, usually a walker, a rollator, those types of things, but really, they're not gonna be able to live alone. So they're gonna need a lot of dependence on those ADLs, a lot of, maybe the aides are gonna have to help spouses, whoever that is. And then lastly, we have the dependent stage, or the 5th stage, and that is when basically they are in complete dependence. They may be bedbound or a wheelchair. It is important to understand that not everyone progresses through the stages accordingly. And I know I have plenty of patients that stay in stage 2, stage 3 for a very long time. So I hope this was helpful for you guys. I'm going to be coming out with more content specifically to movement disorders. But this is just a general overview. If you guys have any questions or anything, please don't